Thank you so much for joining today. My name is Parker. We will go into the diabetes prevention program here at UC Santa Cruz. In addition to the program, we'll talk about roles and responsibilities for myself as your coach and yourselves as participants, what to expect from the program throughout the year, and of course, any questions if you have them. So, to introduce myself more thoroughly, my name again is Parker. My full name is Ashley Parker, but I go by my last name since high school, so you can just call me Parker. And I'm the Health and Wellbeing Specialist in Risk Services. I make workshops for the campus and for departments. I also run health coaching groups like this and roll out the wellness challenges. So basically, the programming to help support the health and well-being of our faculty and staff here at UC Santa Cruz. My background is in nutrition and health coaching, so I did receive my master's in those areas, and I also had the opportunity to work with folks that were diagnosed with prediabetes and help them to incorporate different lifestyle changes and help them implement them into their own routines. I really enjoyed that opportunity and helping folks realize and build the confidence that they need to implement these changes into their day-to-day lives. And that really helped give me a solid foundation for the diabetes prevention program facilitation. We just completed our first cohort, as was facilitated by myself this past December on a personal level. Really like cooking and running. I used to work in a bakery making sourdough bread. So health, nutrition, and well-being are very close to my heart. And I also like to mention that sometimes that goes into ebbs and flows as well. So maybe I might be stuck in a little bit of a rut sometimes. So I understand the changes and the motivation involved to adding or to adjusting habits like this to help improve our health and the process that it takes as well. But why don't we go ahead and get started talking about the program? But before doing that, I'd like all of you to, it may sound silly, but like give yourself a pat on the back or your shoulder for taking one step for improving your health. Whether signing up for this was a big step or if it was a small step for you, any step is momentum and progress. And that's something that I really like to highlight in the program. So the Diabetes Prevention Program is a UC system-wide program, and it's offered at each campus. Most of them are facilitated over Zoom, and it's a year-long lifestyle change program to help folks implement new habits into their lifestyles. The program is CDC approved curriculum, and it's based off of decades of research and has been developed and shown to reduce risk for prediabetes and type 2 diabetes. It's designed for folks that are diagnosed with prediabetes or at high risk for developing it, and for those who want to lower their risk of developing type 2 diabetes. So, what is high risk? Risk factors indicate your likelihood of whether or not you'll develop a certain condition. For instance, family history. If you have someone close in your family tree that has prediabetes or type 2 diabetes can be a risk factor for yourself. Also, having high blood pressure. Age can be a factor, so being 40 and older. Also, ethnicity. So certain ethnicities have more of a likelihood than others to develop prediabetes. Also, physical activity. So having a generally inactive lifestyle is a risk factor as well. Sexes, so being a male increases your risk a little bit as well. And then having a BMI of 25 or higher. And if you're Asian, having a BMI of 23 or higher. So these risk factors don't predict whether or not you will develop a certain condition. Some of these can change, or some of these you have the power to change, and some of these you don't. So the program focuses on the risk factors that you are able to affect, mainly adding in physical activity and adjusting nutrition and other healthy habits. So the program itself sets goals for our participants. For the first 6 months of the program, the first goal is for the participants to get at least 150 minutes of moderate physical activity a week. In the beginning of the program, we'll talk about what that means. And the reason why that is one of the goals set is because 150 minutes of activity at a moderate intensity has been shown to provide health benefits and help reduce your risk of prediabetes, but also other conditions as well. And then the second goal of the program is for participants to begin to see changes towards a weight goal. And that is because research shows that modest weight reduction of 3 to 5% has shown to increase health markers like blood pressure and inflammation, and reduce risk of prediabetes and type 2 diabetes. As a health coach and facilitator, I really like to concentrate on behaviors like physical activity, nutrition, stress management, those sorts of habits over reaching a weight goal. And for me personally, that's because maybe you know someone or have experience of trying to work towards a weight goal, and understanding that that can be done in a healthy way towards implementing these new habits, but it can also be done in an unhealthy way as well. And so that's why I like to concentrate on the habits that you're changing rather than weight itself alone. But that can be an indicator of progress and health as well. So that's uh, one of the goals that we use to assess. By the end of the year, the goals are to continue with 150 minutes of physical activity a week, as well as keep working towards that weight goal if it has not already been reached. The program is primarily held over Zoom. They're 1 hour sessions held on Tuesdays from noon to 1. Our first session to begin the program is next Tuesday on January 20th. And we are recording, and I'll send out the informational session, this one now, so you can have it for reference along with the slides. But due to the nature of the program, we won't be recording those sessions. So live online participation is required. DPP runs for a full year, so from January to December. There are 22 sessions in total and at least one in-person session. For the first 3 months, the sessions are held weekly. For the fourth month, they're held every 2 weeks. And for the remaining 5 through 12 months, they're held monthly. So right out the gate, it is a pretty time-intensive program, but that is because making changes to adding more physical activity and changing our eating patterns can be really hard and substantial changes. Maybe you've heard that it takes 21 days to start a new habit. There is some truth to that, but there is nuance as well. So if you have a goal to wear sunscreen every day, you can put your sunscreen next to your toothbrush, and that serves as a reminder for you to put it on after you brush your teeth before you leave the house. However, with something like adding in activity, maybe if you don't have any in your schedule already, and that hasn't been a consideration for you for months, maybe years, or sometimes decades, adding in that one habit of moving our bodies more is much more substantial. And so this year-long program really helps to implement these new changes in a slow, kind of more sustainable way. There are makeup sessions that are available as well. So the first 16 sessions are core sessions that participants need to attend. And I do highly encourage that you attend all of the sessions because you'll get the most benefit from the program and help in that way too. Question, are you allowed to join from another campus? Great question, and the answer is yes. If this works for your schedule, then that's fantastic. But there are other campuses that may have openings for other times. And so if you need other options, then you can contact me and I'll send all that information to you too. All right, so for the program itself, like what do we do? What do we talk about? We kind of lay a foundation of knowledge and education on how physical activity and how nutrition can work to help reduce the risk of type 2 diabetes. Then we'll share ideas and make suggestions, primarily by the group itself, on how to add these new habits into your routine. We'll also talk about how different life events and vacations, holidays, or social gatherings that are centered around food. We'll talk about how to approach those in a way that helps you still work towards your health goals. Also, we talk about how to overcome obstacles, and you get support from myself, but also from each other in your group in making these changes, because making these changes is hard. Having that community is really beneficial in helping making those habits stick. So there are 22 sessions, and we start off the program with laying out that foundation of getting active, how to add it to your routine, and also what switches do you make to your nutrition to help get you started off. And also how to track your activity and track your food so that you can get an idea of where you are and what changes that you want to make. We also talk about different like lifestyle habits in areas as well, like managing stress, managing triggers that might lead to less desirable habits, and how to maintain motivation and staying on track and getting back on track. We talk about also how to get enough sleep and how type 2 diabetes can impact other areas of your life as well as heart health. So there's a lot of topics that we get into. So it's a pretty holistic approach on how to improve your health and how that all works together in preventing or helping to prevent type 2 diabetes. So for the sessions on a week-to-week basis, every week, participants will report their physical activity minutes as well as their weight to myself. I keep a log of that and use that to help assess your progress and if you're reaching your goals, or do adjustments need to be made. For each session, we start off with checking in, see how everyone's doing, and referring to your action plans what has worked, what hasn't worked, and maybe like brainstorm ideas on how to move forward. Then we'll talk about the session topic itself, and that'll be most of the session content. And then when we tie everything up at the end, we'll always set a new action plan to guide the path on where you're going and steps you want to take until the next meeting, as well as close up with any questions that you might have about the topic or the past topics. Now for roles and responsibilities for myself as a facilitator and lifestyle coach for the program, my job is to facilitate a supportive and respectful group and to create an engaging space, encourage collaboration and creative problem solving. And that is pretty much the cornerstone of the program. I think that you get the most benefit from it, and the participants from the last cohort said that they find the most value in that encouragement and collaboration with each other. And of course, my job is to be mindful of your time. So we'll wrap up in a timely manner. As a participant, your role is to log how much time you spend moving your body. And we'll talk about that in session 2. And reporting your physical activity minutes as well as your weight to myself every week. We'll talk about how to track food as well. So throughout the whole year, we encourage you to track your food, but it's not required. And sometimes tracking a little bit to see where you are at this point in time and what changes you need to make is enough to get you started. So you don't have to do it for the full year, and it's not something that you need to report to me. Next, it's your responsibility to incorporate these habits into your lifestyle with help and suggestions from your cohort and myself. And then during the sessions to show up, participate, and share your ideas so that not only you get the most benefit, but the others in your group get the most benefit as well. Now I'll share some things that the last cohort had to say. I asked them what changes have they noticed in their habits, health, or confidence since participating in the program. So they said things like, I'm more confident in my nutritional choices now, which I was very pleased because nutrition is one of my passions. They also said, I try more new things and will brainstorm different ideas, but learning from other folks and what they're doing can encourage and inspire you to try new things for yourself too. Sometimes things that you may have never thought of on your own. They also say that they use tracking to continue seeing their progress, that I'm proud of what I accomplished because this is hard work. And these changes are big. So taking it slowly and step by step is an accomplishment. Also, I feel better in my body, and I never thought that I could do so much. And for a couple of quick testimonials, one of our group members said that coming to terms with a type 2 diagnosis or pre-diabetic diagnosis on your own is very difficult and can be a depressing process. But when you have community, it gets easier. DPP did make the process easier for me, and I'm sure I wouldn't have made the progress that I did without the program. The materials and shared experiences were invaluable, and I feel loads better about myself now. I'm confident in my health and lifestyle choices, and I now feel like a strong resource for others in my community, whether or not they have a clinical diagnosis. Another one also said, thank you so much for all you've given us as a group, being me as your facilitator, and that this program has been transformational. And lastly, I really appreciate your support and the thoughtful way you've guided the group throughout the program. Being part of this group has been such a meaningful experience, and I'm grateful for the space to share, learn, and grow alongside everyone. I'm especially thankful for the emphasis on grace, balance, and progress over perfection. I feel more confident in moving forward with the tools and habits that I've been building. So I greatly appreciate the past folks for sharing that with me so I could share with you. And I like to highlight the progress over perfection. Doing something is better than doing nothing. And it's not about being perfect. It's about trying and troubleshooting and understanding that there are ups, there are downs. And just because something doesn't work, that doesn't comment on whether you're doing good or doing bad, just that it's an opportunity to troubleshoot and see what other places we can try to make changes. So now, having heard about the program and how great it is, and now that you want to join, um, I'll talk about how to sign up. So there are some criteria for joining. The first being faculty or staff or a family member, and meeting the following criteria. So the first being 18 years or older of age, having a BMI of 25 or over, or if you're Asian, having a BMI of 23 and over. Also, not being diagnosed with type 1 or type 2 diabetes, and not being currently pregnant. Additionally, meeting one of the following criteria as well. The first, having been diagnosed with prediabetes through a blood test, or having been previously diagnosed with gestational diabetes, or receiving a high-risk result from taking the prediabetes risk test. And I will send out a link to that in the resources as well. So additionally, I will send out a virtue protected email so that when you fill out the intake form, all of your medical information is protected. The PDF will be a fillable form, so just download it, fill it out, and reply with that completed form to the virtue protected email that I send you. And please try to send those in by next Monday, January 19th at 11:59 p.m. so I can know that you'd like to sign up, and then I'll add you to the calendar invite. So for a quick summary, and then I'll open up to questions from the group. This curriculum has been based on many years of research. It's CDC approved, and it's been shown to lower the risk of type 2 diabetes. And as a reminder, that doesn't mean that participants will not develop prediabetes or type 2 diabetes, but participation in the program has also been shown to help reduce the severity of those conditions as well. The program is a year long with 22 sessions. The first 3 months are weekly sessions. The fourth month has a session every 2 weeks, and then the remaining sessions are monthly. And each session will cover how to incorporate changes in a sustainable way in a number of various lifestyle areas to help prevent the risk of developing type 2 diabetes. Also, if you'd like more information on cohorts that are offered at different days and times, reach out to me and I'll share what's available to you. So with that, does anybody have any questions? I'll stop sharing my screen. In-person session is not required. I usually look for a room that has Zoom capabilities as well. So you're still able to join in and participate. How are your weight and activity communicated to me? So I'll send you a virtue protected email and you can respond to that and share those values with me. And yeah, super easy. Are there tools to record activities? Yes, there's going to be a whole session on tracking. So we'll talk about a number of different um, apps and tools, and there's a worksheet from the program as well. So there's many different ways that you can use to track. And so we'll talk about a variety and you can choose your favorite one that works best for you. Yes, so next week, we start off with the weight log. And then I think it's either session 2 or session 3 that we talk about tracking physical activity. And so that following week, you'll track your activity from there. But if these are things that you're already comfortable with and you just want to start sharing both of those, then you have the option to do that too. But it's just wait to start. And then after we talk about tracking, then that following week we'll need those numbers for activity as well. Thank you so much.